Hi, welcome to MedTalks webinar series, where you can learn from entrepreneurs, industry experts, healthcare professionals, and scientists who are all striving for progress in healthcare. I'm Andrew Adaby, and in this episode, we'll be joined by our guest, Andy Kinnear. Andy Kinnear is an ex-NHS Chief Information Officer and currently a Director for Ethical Healthcare Consulting. In this episode, we'll be focusing on the recent Darzi report. This latest report looks to understand how the nation's health has worsened over the recent years. And here are some of the key areas. We're going to focus on preventative care to reduce hospital dependency. Underinvestment in infrastructure and digital technologies is hampering efficiency. Staff morale is an all-time low due to poor working conditions despite increased staffing. Waiting times, especially for services such as mental health, are unsustainable. And social factors like housing and income worsen public health and increase demand. Lots to discuss. Let's engage. Hi, Andy, and welcome to this episode of MedTalks. How are you?
I'm good. I'm good. Yeah, good to see you again, Andrew.
Fantastic, great stuff. Well, let's jump straight into it. The Darzi report, which was now launched maybe a few weeks ago, has several points which I mentioned. Now, the report emphasizes shifting from hospitals to community settings. How do you see this transformation and what challenges might arise from reallocating these resources?
Yeah, I've got to say straight off the bat, I think Darzi's really shot from the hip on this one. I think it's one of the most honest assessments of where the NHS is at right now, and I think he's to be commended for being so sort of candid in his in his feedback. Really, I think the challenge, certainly what I've witnessed over decades really is that what you're talking about is the boundary between one set of organisations and another. So the boundary between acute hospitals in that case and community services in another. And the recent attempts to develop the integrated care system model is an attempt to try and build a collaborative health system. So how do you actually achieve, moving some of that care from acute into community? Well, you need collaboration across the health system to transfer some of the funding and some of the workforce and some of the effort from one part of the system to another part of the system. Why do I think this is challenging right now? Why do I think it's probably taking time to happen? I've got a couple of theories. I mean, one is I think when you look at other industry, you look at big business in other sectors, when they are trying to transform the way they work, they make an investment in that transformation activity. I think too often what the NHS seeks to do is to define a transformation it wants to happen, but the money is only actually still going into the existing services running in the existing way. And so if you're not making an investment in the actual change or sufficient investment in the actual change, you're not likely to get that change. I think that's one factor. I think secondly, the incentives aren't always there. So whilst the ambition might exist, if the financial or kind of workforce incentives are not aligned to make that happen, then you don't get the necessary sort of behaviours you want to see. And then I think lastly, for me, and this is a bit of a Kinnear theory, I haven't got a ton of evidence to back this up. But what happened in the early 90s when John Major's government introduced the purchase of provider split into the NHS, and they created this idea of commissioners and providers. The sort of political dogma that sat behind that was that competition is a good thing. And if you introduce competition into organisations seeking to access, the monies to deliver healthcare, you will drive, the efficiencies that we would routinely expect to see in the private sector. And that dogma has really been in place for, best part of 30 years. And I think what's happened is the leadership, the people who've developed into leadership roles in the NHS have been people who've perhaps been naturally drawn to the competitive environment that exists. All of a sudden, we're seeking these people to be, the great collaborators. We're inviting them to actually work together and collaborate across those systems. And, I think that's a personality change for some of these characters. It's like hard, they're sort of, well, hang on a minute. My entire career has been spent sort of competing and being on the front foot and being that sort of, almost edgy capitalist, trying to, win the next book type character. And all of a sudden, I've now got to be friends with everybody I've been competing with and work together. So I think that cultural change that needs to take place underneath is taking time to bed in. And I think you can sort of see it. You can see the geographies that have, got to it quicker, maybe had different sort of characters in there, or had a big leader who's been able to, transcend all of that. And you're seeing other geographies that are struggling with it and maybe haven't got that. And I think, in truth, I think this is years. This sort of change takes time. It took 30 years to embed the version we had previously. I don't think it'll take that long, but it's certainly going to take more than 5 minutes to get to a place where we're working better to achieve exactly the kind of changes you've described.
And I fully agree. And talking about shifts as well, there is going to be a shift towards preventative care, which makes sense. Now, what strategy should the NHS adopt to ensure earlier intervention and reduce the long-term burden on hospital services?
Yeah, I mean, I think the first thing to say, I would sort of, I don't want to sound too NHS defensive, but I think um, anybody who sits through a talk and listens to an expert in the social determinants of healthcare realizes that preventative healthcare begins in sectors way before, the NHS gets involved in somebody's life. It's about making sure people have got, good quality housing. It's about educating them on, healthier lifestyles. It's about giving people a decent living income so they can, have a decent, a damp-free home with a decent diet and all of those sort of things. I think there's something about incentives within our society about how we incentivize people to, take care of themselves better and to look after themselves better and to sort of be on be on that front foot when it comes to, prevention, things like that. That might be around healthcare things in the way that we're seeing um, great efforts, I think, at the moment to improve the flu vaccine uptakes or, COVID vaccines and things like that. So preventative steps that the NHS can get involved in, but more just more generally, a sort of way in which we promote healthy lifestyles. I think there's a role for, regulation. You talk to any dentist these days, and they'll tell you that it's sugar in fizzy drinks that's ruining our children's teeth. Well, you've got to ask a question: why is the country putting sugar in fizzy drinks then? I mean, it doesn't feel like a very complicated problem to solve, but you probably understand what's going on. And then I think to bring it back to the NHS in particular, I think we've seen through the austerity years and through the cutbacks in funding through really since 2010, we've seen an erosion of some of those preventative programs, whether that's around screening services or around some of the public health investment that went on. We saw huge reductions in sort of public health investment, and I think those things have been factors in making us less, less sort of proactive really in that sort of preventative space. But you're right. I mean, I think if we could solve these things upstream, you're taking a big burden off healthcare.
Sure. And one point about burden on healthcare, we're going on to facilities now, and then the previous governments were having a big push for the hospital building program to improve our facilities. Now, what kind of other investments are urgently needed to improve the status of our NHS facilities?
Yeah, I mean, I mean, they did, but I think their story compared to the reality was a little bit. I think it was a victory in marketing more than anything else. There's no way 40 new hospitals were being built. That's the first thing to say. I mean, I was comparing it a little bit. I mean, I don't want to get too political about these things, but I was comparing it a little bit to when Blair arrived in government in '97 and the investment that they began to make in the NHS, back then, which was, significantly more than we'd seen, previously. They kind of him and Gordon Brown as Chancellor, increased the investment in the NHS, and a lot of that was directed towards addressing, capital estates type issues. Lots of it went into primary care, improving, GP practice buildings, some of those really aged Victorian, places that just weren't really fit for modern medicine, things like that. And we saw big investment in new physical estate. I think we're probably ready for more of that again. Definitely in acute sector, you can see some of the hospital buildings you go to are just absolutely, shocking, really. And so there's a sort of big investment in capital in that. I think, coming from, putting my CIO or former CIO hat on, I'd argue there's also a massive opportunity to invest in the digital landscape, and to really begin to sort of do what we should have been done by now in many ways, but actually get us to a truly digital health service and begin to drive the kind of efficiency and productivity that we've seen in other sectors who've made that investment in that digital infrastructure. The bottom line, though, Andrew, is all of this needs money. And I know it's a bit of a broken record to hear people from the health service talk about, the investment that's required. But if you look at the chart on funding for health service from 1948 all the way up to Tony Blair coming into government, funding was grew at around about 3.7% a year.
Mm-hmm.
The King's Fund have argued that it should be around 4. We see about 4% growth in demand for health services due to an aging population, due to new medicine being invented, and due to the way we've been relatively successful with many of the acute diseases, meaning we've seen the rise of dementia and diabetes and things like that. So if we assume there's a 4% rise in demand for health services each year, seeing a relative rise in funding to stay at pace with that is not a ridiculous ask. And yet, from 2010 onwards, certainly 2010 to 2020, up to the pandemic, that was running at about 1%, well, about 1.4, I think. And so we've seen huge erosion in the investment levels needed to maintain our health service at a place where it serves the British people in the way that we need it to. And I think we're starting this decade. Well, we're running into this decade, and certainly starting this new government period with I think a realistic ask for more investment. Now, recognising where our economy is at, recognising what the government has inherited, I understand that's not an easy challenge for them to step up to. But at the same time, I do think it is it's a valid case to say, well, if you want the health service of the future, one way or another, we've got to find the investment monies to make that happen.
Very interesting, that lack of investment at 1.4%, because the ramification of that is not just the infrastructure, it's also the people. Now, staff morale is at its all-time low, huge burnout, very, very difficult to retain high talent. Now, the difficult question is, how is leadership going to try and retain and recruit? So therefore, we kind of make sure we're not having this huge burnout and the gap in the workforce that we have in the moment.
Yeah, I mean, I think I think of all of the stuff in Darzi's report, the section on the workforce is easily the most depressing to read, actually. And I mean, certainly as somebody who's dedicated, I dedicate most of my life to working full time in the NHS, and I think the people who choose to go into the healthcare sector, you think of the decisions they made at 16 years old or 18 years old or 21 or 24, whatever when they joined, they've decided to dedicate their life to the care of strangers, to sort of give up all of the other potential and certainly more wealth generating careers they might have pursued. They've actually chosen to to be those people who care for us in our most desperate moments, and to see them so mistreated by government, and I think honestly undervalued by society. I think we've seen. I just find it incredibly depressing that a group of people that none of us could live without, and actually really really value when we need them, or have been treated so poorly. And I think there's the bit where Darzi talks about the loss of discretionary effort, the reduced amount of discretionary effort that people are putting in, I think it's easily the most worrying part of the report. What I've witnessed over my years in the NHS is people constantly going the extra mile, constantly doing a bit more than frankly they're paid to do or they're asked to do, because they so believe in the system, they so care about the patients, they're so committed to the service. And I think that sort of social contract, however you want to describe it, that kind of contract between the workforce and government has been lost over the last 5 or 6 years. And I think that is a very worrying thing, because I think it was probably the thing that was holding the health service together, in truth, as the funding came on. I think we've started to see attempts to reduce, to repair that. I think the pay settlements and the ending of the industrial action feels like a step in the right direction. I think we need to start shifting a conversation to be more grateful. I'm conscious. One of the things I've noticed, I don't know if you notice when you go to the US, whenever you're in a situation where you bump into somebody who's been either part of the military or is part of the military in the US, there's a sort of societal culture for people to thank them for their service. I thank you for your service. You witness this all the time, and I think wouldn't it be great if we actually got to a point where our doctors, our nurses, and all of our care professionals were treated with that kind of level of recognition, where we actually said thank you for what you do for us, and our country actually operated in a way where we recognise that, because I think actually that's what people crave, probably more than massive salaries and all of this sort of thing. They just want to be appreciated, and I think so. I think a leadership that comes in and says the kind of things I'm saying, that recognizes that actually appreciating people and the contributions they make is a good thing to do, then that would be a big step in the right direction. I mean, personally, I also think one of the ways that will happen is if we have more leaders at national level who've spent longer time in the front line. So I think that, one of my big beefs, I suppose, is that there often feels to be quite a significant detachment between the people at the centre running the health service for the country, and those people who are right down at the front line trying to deliver day to day. And I think until you've closed that gap, then I think we're going to struggle to really sort of make headway. But it's all doable. I don't think anything I've said here is particularly revelation. It just needs action. It needs people to sort of step forward and do it.
And one of the other pressing matters will be the current backlog. I mean, we're currently around about 7.6 million patients in the backlog.
Yeah.
Mental health was actually highlighted as one of the areas in the Darzi report. Now, there's lots of ways to try and tackle this, but from your point of view, and I'll be interested in your answer from a tech point of view, maybe an AI point of view, how can we help reduce that number down significantly over the next 5 to 10 years?
Yeah, well, I think what we've witnessed certainly in the most recent times really is sort of slightly is a tail gunning approach to waiting list management, in truth. So people worried about the back end breaching, high level targets, 18-month targets, 2-year target, whatever they are. And so you see that kind of tail gunning, we've just got to treat the people at the back end rather than a more sophisticated way of managing the care. And I'm hopeful that again, with new government, new targets, and so on, we can move to a bit more of a grown-up way of trying to address the volumes that we've got in there. But I think you're right. I think you're right to highlight the role that technology could play in in the delivery of these services. And I think you'll have been in trade shows and conference halls like I have over the last couple of years. You cannot move for people throwing AI products at you and things. It reminds me. I'm old enough to remember the birth of the internet, and I can remember going to those halls, back in the 90s, and everybody was saying online. We've got this, online that. Online. It was online was the thing. It was kind of the great revelation that we're moving from something to online, and AI is in that same space. And I think the sort of willingness for us to be prepared to try this stuff, for want of a better way of putting it, to give it a go and see if it makes a difference. It's all we're in the invention stage, aren't we? None of this stuff is kind of fully formed, well established necessarily yet. And so I think there's a sort of have a go, see if it makes a difference. Let's see if we can work it through, I think, is one task. I think the second task, certainly for the NHS, is we have got to make it easier for innovators to engage with us. I think we've had goes at this. We've seen HSNs and now health innovation networks and so on attempt to do this. I still think that the bar is way too high for somebody who's inventing something clever to come and work with the NHS and find it easy. So I think that would be certainly something I'd love to see improved. I'd like to see some of the procurement and regulation rules, looked at to address. I've been my latest kind of little fetish, I suppose, is to watch stuff around regulatory capture and the way the incumbent, the big players in markets go and sort of capture the regulatory frameworks in a way that essentially stops new entrants
Mhm.
coming in and new sort of innovators coming into to a market that they have already effectively secured. And I think, there's a big question for us to go and have a look at some of our regulations and say, well, actually, how can we modify this to create a much more vibrant market to allow those players to come in. And then I think your core question really about the mental health thing is I've lived through. I mean, I've lost count of how many times the NHS and certainly government has promised the public to deliver parity between physical care and
Mm.
mental health care. It's a broken record, frankly. The number of times this promise has been made to our public, and yet it's never happened. That's the truth of it. It's never happened, and mental health services have always been the poor relation in this situation. And I think the question is for me as well, if we're saying it this time, do we really mean it? I mean, I don't know, but we could. I mean, we just got to want to, really want to make that happen. And I'll come back to the point I was making earlier around, collaboration and things like that. If you're giving a health system, the whole control of its whole budget and then put some targets in there or some incentives in there, or some leverage in there around, mental health being a bigger part of that, well, you would see more investment in mental health services and the technologies that might, support that as well. So I kind of, I don't think it's in the realm of impossibility, but you've got to want to do it.
And I want to give it an impossible final question, and Andy. So you've seen significant changes in the NHS. I mean, the Darzi report doesn't exactly paint a rosy picture of the current of the NHS. I'm going to give a magic wand, and in 5 to 10 years time from now, and I'm talking about the political cycle, Labour think they will be here for the next 2 terms. Um, with what's going on and what Wes is talking about, how do you think our NHS will be in 5, 10 years time from now?
Yeah, well, somebody said to me, could I see green shoots in what Darcy had written? And I said, well, I can't see green shoots, but I can see he's definitely planted some seeds, and I think some of those seeds are beginning to germinate. So we'll see. Well, I think we'll see seedlings over the next 12 months. I mean, I think it's a fundamental question for the nation in many ways. I think we did an amazing thing on the 5th of July 1948. We created a free at the point of care health service. And it's probably one of the few things that as a nation we virtually entirely agree on. It's an amazing thing. So if we really believe that, and if we really want that, then I think we've got to be prepared to make the changes, as a society to allow it to survive and in the end to allow it to thrive. And I think that means we've got to be prepared to pay for it in whatever way that comes about, but we've got to be able to, we fund it properly. I think we've definitely got to have, 5 years from now, I would hope we are witnessing uh, collaborative leadership, the like of which we've never seen before. I think one of the indicators of that, Andrew, will be when we start to see the big dog leaders, the characters I mean, you can name them, when we start to see them taking the roles at system level rather than hospital level. So when those sirs and profs and lords and ladies and what have you start taking those chair roles at system level more than organisation level, then I think we will see some level of success because that means that's where the power has moved to. But I kind of, I think what we ought to be aiming to get to at that point is year on year funding growth in line with demand. A culture in which we respect and value the roles our clinical professionals play, our doctors, nurses, and so on and so forth. And a technology transformation that looks something like what we've witnessed in other industry. So, we've all lived through this incredible revolution where we book our holidays online without going to a travel agent. We sort of do all our shopping online without. Crikey, when I go to Tesco's these days, I work the tills, for one customer. we've all adapted and developed a way in which we can work with technology. And yet the health service feels a long way behind that. And so wouldn't it be great if 5 years from now it was, we were routinely, booking our hospitals appointments online, we were turning up, we were checking in, electronically, digitally, we were updating our healthcare ourselves into our own electronic patient record, and we were only seeking intervention from medical professionals, as and when we absolutely needed it and things like that. So I think you can see what a transformed healthcare system looks like. And I don't think it's out of reach, but I think it's a nationwide endeavour. I don't think it's like you can just ask the NHS to do this. I think the entire country has got to recognise their responsibilities in making this happen.
Andy, it's been great talking to you today, and hopefully we'll invite you back to MedTalks at some point in the future.
Thank you so much. Loved it.
If you enjoyed today's episode, subscribe to our channel, share it with someone who might find it useful. You can find all the resources we talked about today in the show notes on LinkedIn, X, TikTok, and YouTube. Thank you so much for listening today. We appreciate your support and we're keen to hear from you. Goodbye.